Now we're scanning the right lower abdomen to rule out cause of pain. Here we see the gut in which food particles are moving. The walls of intestines are inflamed. The hypoechoic layer is muscular layer and the echogenic layer is submucosal layer. These layers are prominent and inflamed and thickened. Here we see the blind end of the gut, which is dilated and prominent. This is cecum and this is proximal part of ascending colon. Here we see gases and free fluid. The blind part of the cecum give appearance of inflamed appendix, but the presence of fluid and gases indicate that it is cecum. Now we continue scanning to see the proximal part of ascending colon. The proximal part of ascending colon is also inflamed and the walls are prominent and thickened. But the middle part is normal and not visualized. Now we continue scanning around the cecum to find out the appendix. For that we will fix probe at the cecum and then tilt probe up and down to find out the appendix. Here we see a hypoechoic area posterior to the cecum. The surrounding tissues are also echogenic. Now we will focus on the hypoechoic area. By rotating the probe at its axis, it becomes a lumen. These are blood vessels, but due to inflammation of surrounding tissues, they are poorly visualized. Now here we see another hypoechoic area posterior to the cecum. Now rotating the probe at its axis, it becomes a lumen. This is appendix. The surrounding tissues of appendix are also inflamed and echogenic. The distal end of the appendix is not clearly visualized, and here we see the fluid containing debris. Minimal collection is present at the distal end of the appendix. The distal part of appendix is not clearly visualized due to collection. Now we will measure the anterior-posterior diameter of appendix. The anterior-posterior diameter of appendix is 10.4 mm and the normal diameter of appendix is up to 6 mm. Now how we will write report.